Hello and welcome to the Rooted Remedies podcast. In this next few videos, we will be talking to Dr. Claire Stagg, a practicing dentist in Florida. It was a lovely time. I learned so much from her, and I hope you guys get to enjoy and benefit the information that she shared. This is her children's book, Captain IFBI, already available, and her first book will be coming out June of 2024, so hopefully I'll be able to enjoy that myself. But again, just take your time, go through the information here because there's a lot of wisdom in what she shared, and I wish her nothing but the best, and I thank her from the bottom of my heart, everything that she shared with me. Thank you, Claire, and enjoy the video. Hello and welcome. My name is Ethel, and with the Rooted Remedies podcast, I am here happily with Dr. Claire Stagg. Today we will be getting to know her book, and just a few questions that I have for her that are exciting. All right, let's get into it. Miss Claire Stagg.
Yes.
Please give us your origin story and how you came to the form of dentistry you perform now.
Oh, wow, that's a long journey. All right, so what makes me different?
Mhm.
I was born of a French mother from Martinique and an English father from England that settled in Trinidad. And not being able to have a proper means of education, long story short, after the Black Power Revolution in Trinidad, we were shipped off to Martinique. I was to where I did high school, and from Friday, at my education in English went to Easter Tuesday in French. And then didn't want to do that over again for university, so I went off to France. So actually my dental training is different than the average American dental training because I studied in France.
Okay.
So that's the first thing.
Yeah.
The second thing is that I came back after France and I went back to Trinidad to practice. There was a big economic slump back in the early 80s after with OPEC and everything.
Mm-hmm.
And I decided not to go where I was wanted, but to go where I was needed. So I went to Grenada after the intervention that Reagan sent troops and liberated the island, so to speak. I worked there for the local government for nearly 2 years. I met my husband-to-be, who was American at the time, and left Grenada. And okay, so I'm going to be working in the States if I marry an American, and then realized that they didn't recognize my French degree. I could work anywhere in the world, but North America.
Right. Oh.
So I had to do a multitude of examinations over again, and that was my first exposure to the English and / North American way of practice, which was I had to do National Boards Part 1, National Boards Part 2. Then I had to do, to be able to practice in Florida, a mannequin exam that put me at the level of any doctor wanting to come to be able to practice in Florida where I'm located. And then I did the Florida boards. And then I could practice in Florida. And I've been practicing here since I got my boards in 1989, I think it is. I lost track.
So 30
or 91, I can't remember. I did 89, I think. I went out on my own in 91. Yeah,
Okay.
It's been a long time. Yeah.
Okay. And then specifically,
Was that what you wanted, or did I
no,
go a lot more?
that's good.
Yeah.
No. And then the shift to holistic dentistry, because
All right.
dentistry.
So
has,
that's okay. So that's what happened. Is when I first started working, I worked for other doctors because it's a big jump. That's why I was confused with the dates. It's a big jump working with people, for people, and on your own.
Mm-hmm.
And when you work with or actually for people, you have to do, in order to get a paycheck, what they tell you to do. And ethically, morally, and in my heart, I just couldn't do it.
Mm-hmm.
It was not right. I don't want to go into details. It just wasn't right.
Yeah.
In so many different aspects. And that's why I said, I can't do this anymore. And so we opened up this teeny little office on Sana Road in Melbourne, and I actually was there for 13 years.
Mm-hmm.
And that's when I went ahead and I started doing a lot more learning. It's like, okay, why isn't this working? Why isn't this working? And if there's one thing about me, it's like I don't like doing things over. If I'm going to do it, I'm going to do it right the first time. And if it's not working, it's like, why is it not working? I'm a why person. And so I kept this journey. It's like, okay, why am I not getting the results that in my heart I know? And that's where the conventional says, okay, you do it this way, you do it this way, you do it this way, but it's like they're not getting better.
Right.
And why?
What are some examples of what wasn't working? Just so we have an idea.
So that's what the book is all about. The patient, back in the early 1900s, if you will, they threw the baby out with the bathwater, and they made it to where we became, with a pandemic of sugar, we became major restorative, mechanical, drill, fill, and bill.
Yes.
That's what it was. It's like there was so much decay with the advent of processed foods and sugar, not the healthy sugar, but the refined sugar that was actually very detrimental to health, period. What happened is the dentistry that used to be an art form, Dr. Al Fonda, who wrote a book called The Dental Physician, we used to be neurological bioengineers. That's what we did. I mean, this was our domain. And this domain, I mean, think about it. That's the head. And that's the whole cranial system. We're in charge of that.
Yeah.
People don't realize what a big influence on the body this whole little part has to do. And so what happened when they started restricting it to just drill, fill, and bill, the schools lost the total capacity of healing the body through the mouth. Totally poof, out the window. First thing. Second thing is they made it to where they restricted what we could do. All the naturopathic, homeopathic, all the natural medicines got
removed, disappeared.
Yes. And so that was another thing. And then the third thing is that it was more and more complicated to be able to use your intuition to be able to heal yourself and to continue what needed to really be done. So rephrase your question again so I can add more to that.
Your origin story, how it led you to this
so
natural,
so examples.
I called it biological earlier,
right. So examples. Well, again, the body as a whole, all right? So that's what happened is we were restricted, or are restricted to this. And then afterwards it was like dentistry has always gone through phases, and that's, it's always been phases. So at one stage it was the cavities. Then the next big phase was TMJ, and then the next big phase was implants, and then the next big phase is airway. And it's like, okay, that's still little parts of the whole thing. So what about the whole person?
Right.
And so that's where in my book I bring it back down to the whole person. I talk about structurally, chemically, mechanically, functionally, emotionally, spiritually, and it's all connected. You can't break it down. And we talk about it, what was in the past, what's in the present, and what's in the future, and how it should and could be. The book actually, so it's going to be printed. This is my little version, just so I had something to show you. This is my resource for all mothers that have questions on how it's connected. And that's what we were talking about earlier on, is that I had the why questions. Why is this happening? Why is it not getting better? And I dug and I dug and I dug because I had the same thing with my kids. So
yeah, I'll say it here for any new listeners. The origin story is my daughter fell at the park.
Right.
And she develops a lesion on her tooth. She chips the right side very, very minimally on just here. And then the other tooth, maybe a week or so later, I notice a lesion. I take her to the dentist, and the dentist, classic, traditional, conventional dentistry. Okay, don't let it turn into a cavity. Here's your bill. And I was like, oh, okay. Wow, what does that mean? And if you knew me, you would know that I took it very seriously. And so what ended up happening, and she's almost 3 now. What ended up happening was every book that I could find, a Weston Price book, Curing Tooth Decay by Mr. Nagel, and then the list goes on and on and on. And so now it's under control in the sense that there's no staining. It's a perfectly white lesion. I think I've done my part in not letting that.
Right.
But what I've realized in that process is that it's, as you're saying, more than just hygiene, more than just the Hollywood smile, as they call it.
I call it the Whitney Houston all white smile.
Yeah. And I've found this whole alternative movement to doing things differently that, as you say, addresses the whole child. And so here you have it, the petals. I've seen the more interesting one I've seen is a German doctor or a German practice where they use light kinesiology, and they're using coherent light to reflect in the tooth. My mom makes fun of me. She's like, oh, that's just another product. But I feel like at least it's addressing other aspects of the child that's not just let's put some sealant, let's put some...
So what you just talked about, and I can tell you everything we're going to talk about is probably in here, or I can talk to you about it, because this has, and this is very important to know, is that when I wrote this book, which is my life work, but I started officially, I handed a stack of papers to an editor, and I said, hey, I wrote it, now you put it out there. 10 years later, it's still here.
Yeah.
Every single point that I make has a note / reference, a paper, scientific reference to it. I have my thesis had over 350. I think I'm pretty darn close to this also in here. It's not a woo-woo book. It's very
But it ends up being woo-woo, no?
No, because it's so smartly logical, as you can't refute and defute the science. It is what it is. You could be bornier, we say in French. You could have blinders on and not think outside the box, and you could be gaslighted / driven to be always taught one thing, but it doesn't mean it's right. And if you have something repeated to you often enough, the lie becomes your truth, your reality, but it's still not the truth, but it's yours. And then you go from what you think to then you became a belief, then you become passed from generation to generation, becomes tradition, still not the truth. So it's like, okay, let's stop that. Let's empower back the families to be able to take care of themselves with knowledge, and knowledge is power. So whatever you learn, it's like, oh, this makes so much sense, then why isn't it taught this way? So that's what I'd like to do, is I'd like to go ahead and to have, what I say is I'd like to change the way dentistry is perceived in the world, forget hair, in the world, because the book is for moms who have questions. And if you think about it, if the book is for moms who have questions, that's the demand. So if they ask questions, they're going to want people who can help them, right? All right, so who's going to help them? They're going to go to whom? The dentist, right? So the dentists need to be taught this, and they have to have questions, and you're going to find that there are more and more people like me out there who just didn't feel happy with what they were taught anymore, who are doing the research. I made it easy for them. So the goal is to go ahead and to change the demand that will have to change the supply. And eventually all this will come back. The bath water that the baby was in, we're bringing it back the right way. Clean, happy, pristine, so where it's the whole body that's taken into consideration.
So following that thread of the whole body into consideration, why should we consider the patient as a whole, or the child that's in front of you, or why should we consider them as a whole? Why is there wisdom in teeth? How do you use that in your practice? You have a new person that comes in. How do you assess them? How does all of that in the appointment? How does that happen?
So my system, Health Connections Dentistry, the first thing I do is I go ahead and I look at the person. Everybody complains about the amount of forms they have to fill out, and it's like, it's okay. Trust me, I use them all. So the whole idea is that, yes, you're a little person, so you could be a child, you could be up to 100 and something, but you have organs, you have other body parts, and everything's connected. Think of it as Pinocchio, all right? So Pinocchio with his strings. And each part, structural, mechanical, functional, emotional, spiritual, and chemical, each part is a string. And what happens, it's the weakest part that's going to break first, right? Okay, the weakest link in the chain is always the part where the chain breaks. And usually, Chinese medicine, you can diagnose over 250 diseases in the mouth just by tongue therapy as well as mouth therapy. That's the chemical aspect that's in the book, all right? A child should not just get decay, all right?
Right.
So why is there decay? I'm a why. There's going to be a lot of whys, okay? Structurally, why is the bite off? Why is the child not breathing through the nose? Okay, so is it because of the mouth? They never really could have room for the tongue? All right, so, and break it down in a nutshell. There's two things you need to do to survive. One is breathe and one is swallow. There's two things you need to do to thrive. One is breathe and one is swallow. What do the two things have in common? Tongue and tongue space, right?
Yeah.
So, same thing. Why aren't we nursing anymore? Why aren't we checking for tongue ties? Why aren't we checking for nasal airways, breathing? You know, you see a lot of marathon runners, they're now doing it where you have sports people running with tape across their mouths. Well, they're trying to prove a point. It's like we breathe through our noses, we eat through our mouths, we don't eat through our noses, right? So it's a whole process. You hear trickles here and there and everywhere, but everybody's bringing it together. The thing though is that big cobweb, how it's all connected, you're only seeing little pieces of the cobweb. The most important thing, and that's what I like about this, is I put the whole cobweb in there. And it's like, okay, now you see how it's all connected, because it is. So a child comes in, if you want to talk about a child in particular, what I'll do is I'll do an examination. And yes, we do take radiographs. I call them radiographs and not x-rays, because people think you glow in the dark with x-rays. We have digital radiography, so that really makes it great. Depending on the issues, I can do a 3D cone beam. All right, that's where I can see from hair to hair. I, in my practice, have an extended field of view where I can see from their neck up, so I can see their airways, if there's any restrictions, soft tissue, hard tissue with adenoids and or tonsils, etc. And then we measure everything. I measure everything.
I've heard your appointments are really intense.
Wow. We have fun, but it's very thorough. Okay. I think the word intense is can have a negative connotation. I like to think that it's very thorough. And that's what everybody says. Wow, I've never had a visit like this before. So yeah.
And just in general, do you lean towards tongue tie surgery, or is it something that you really do a case by case basis? Because
everybody's different. You can't lump everybody in a basket. That's what's wrong.
Yeah, I find we're a little quick in general dentistry to tongue tie for sure. Go ahead and do it.
But that's the other thing too. Is like, wait a minute. The tongue is like a slinky. If you let it loose, it's been tied. I always give analogies, so I might jump from one to the other. But if you have a horse that's been behind a gate and the whistle blows and you open the gate and he runs, where's he going to run?
Right.
He has to know where to run to. So that's where the jockey goes ahead and goes around the track and he stares, and that's why you have the blinders and you go around the track and poof, whoever comes in first, right? It's the same thing with the tongue. If it doesn't know where it needs to go, it's just going to flop around everywhere, and then the tether readheres it to itself, and then you have scar tissue and So long story short, I work very closely with a myofunctional therapist. All right. Well, first of all, I have to determine if they're tongue-tied and what it means to the rest of the body.
Right.
All right. Airway, swallow, speech, diction, all that stuff. See, there's a lot more to it, right?
Yeah.
And then figure out, okay, well, if you do have an issue, why is there an issue? And then, is it structural? What are the consequences of the issue? Will you get better if we address the tongue tie? And if we do it properly. So go ahead and have a myofunctional therapist. Will re-educate. It's like if you're going to run that marathon, you get your muscles all primed and pumped, ready to run, tethered properly. They see the myofunctional therapist, who then gives me the green light and say, okay, we're ready now to do the releases.
Okay.
Last year I invested in, because I got tired of referring my patients out. It's like, damn, why can't anybody do this and do it properly and do it well and do it efficiently? and follow a protocol that makes a lot more sense. You just don't go and do a tongue tie without. And yeah, again, I decided since nobody was doing it the right way, I went ahead and I got a laser, and it's a CO2 laser. And so when the myofunctional therapist gives me the green light, that's when I go ahead and I do the releases.
And just out of, this is personal curiosity, but I'll leave it in the program. And my daughter was also told that she had the lip tie. And
Correct.
and at that time, it was the year or so age, I was very torn, and I was like unsure, and because, and I would just love your perspective. Should I have done it then, or should I have allowed for some more development to happen?
So you have to figure out what is the lip tie restricting.
Well, it felt like a blanket. She's got lip tie, you need to cut it, which is why
No, if she's fine, then that's okay. However, what are lip ties? They usually, when you go ahead and you think about it, if you go ahead on YouTube or Google, there's lots of great videos on there. That's why I said research, because it's all there. You just have to know what to ask for.
Right.
So what happens is there's an inversion or a change in the positioning of the lip that actually latches onto the nipple, and the nipple, the suctioning with the tongue pushes the nipple, if you will, and then the milk squirts back. But if that lip is tied, then it cannot go over the nipple. All right, so then you're going to have improper latching, gas, etc. So if it is a detriment to nursing and latching on, then yeah, go ahead and do the lip tie release.
Okay, I feel like I made the right decision in that there were no issues latching. She ate well, no gas, no,
Oh, there you go.
Thank you.
Yeah,
so
yeah, but I mean that's the whole thing. It's not a cookie cutter thing, and it frustrates me to no end when patients come in and they say, "Well, I was told this," and it's like, why?
Yeah.
Okay, so they run all these medications, and I look at them and I say, why? And are you feeling any better? No. Okay, why?
Right.
Okay, so why? Why is this happening? Find out the root cause. That's the name of your show, right? The root cause.
Remedies.
Right. So find out the root cause and then address it. So the best analogy I give to my patients, it's like, think of yourself as a box of 5,000 puzzle pieces, right? And you're here, and I have all these, 52 cards, whatever. But when you walk in already, because I've been doing this for so long, I already can see what's going on, right? Okay, so I already know if you're here and where you are ideal. All right, so think of yourself in a picture frame on the wall, and wellness, whole health is figure it out as a dartboard or the picture frame. Every and anybody just throws stuff at the wall or the picture hoping something will stick. Me, I want to hit that bullseye every single time first. And usually what happens if you go to the root cause, a lot of the subsidiary symptoms get dissipated and or taken care of. With time, the really, 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 really much deeper issues will then get addressed. And then they pop up. And it's like, well, you never told me that was going to happen. Well, we didn't know, did we? Right. You've been suppressing this since probably maybe even in utero, maybe during your birthing through the birth canal, maybe when you were an infant, whatever. Stuff is going to happen. And structurally, that's where too, I work with appliance therapy that releases the cranial strains. A lot of stuff happens when you're being pushed through that birth canal, all right? So you can be lopsided, you can have issues, things that get compounded if you're not nursing because you have a bottle, so that changes the way the nipple changes the palatal
oral
formation.
Cavity, yeah.
All right, so the same thing, everything. It's like a
cascading effect, I call it.
All right, that's the rabbit hole. That's what I call going down the rabbit hole. My goal is to reverse engineer how you went down the rabbit hole. That's what I do. That's what's in here.
I've read very recently, maybe 2 weeks ago, that if the baby also spends too much time on the floor, because this is so, their skull is so pliable still, that can also shift everything.
Or in a car seat, or on a baby rocker, or anything. You have because the sutures are not fused.
Right.
No matter what anybody tells you, the sutures are never fused. Conventional dentists are taught that they fuse at 9. No.
Well, and then to segue to Marcos, but Marcos was like, I asked them all the nerdy questions. Okay, what was the appliance
Now
like?
let's let everybody know Marcos is your nephew.
Marcos is my nephew, and you treated him with his
an oral appliance to help with the expansion.
And then, which I have the video ready to go. I say, okay, so what is after this? And he's like, no, I'm done. And I was like, that's not possible.
Yeah.
Because these aren't fused, and because
Correct.
you're always growing, and the input is always changing.
Correct. But
yeah.
in his mind, what he's saying is that I don't have to go through braces.
Right.
So that for a kid is huge and very important, right? Unfortunately, they still are pulling teeth out of kids to make room. All right, so let's have an analogy here, all right? You have a 20 by 20 square foot garage, all right? All right, you can park 2 cars in that garage, all right? But let's say the walls aren't quite linearly straight, all right? Do you think that taking out 2 feet here, 2 feet here, 2 feet here, 2 feet here, and then making them straight, but you're restricting the actual length, what have you just done to your box? The square footage is smaller. Do you think you'll be able to park your 2 cars still? No.
Right.
Maybe a car and a half. Okay, how do you think the tongue now feels? That was your car.
And in this time that I've been researching, I even noticed it in myself. Like, my mother didn't know any better, so we did normal dentistry, and my wisdom teeth were removed. And then I can see myself in the mirror, and I'm like, okay, why were my wisdom teeth removed if I'm still having misshapen teeth, like coming in and out? It wasn't the right thing to do for this result.
So there's so many things there. So many things. All right. So Dr. Weston Price, I love him. He's talked a lot about it in my book. All right. This book is, I think, if you really want to deep dive into health, nutrition, and physical degeneration. This doctor left his practice in late 1890s. And we talked about this earlier on. Went around the world, lived in indigenous countries and tribes, and found that those who stayed in their villages and ate their indigenous foods developed healthy bodies and faces, and really broad arches, right? With all 32 teeth, no wear, no tear, breathe through their noses, nice broad palates, everything was normal, all right? There's a Dr. Harville study that shows when they clogged the noses of nostrils of monkeys, you had the monkeys that could breathe normally, had perfectly normal bites and mouths. Those duck monkeys that had their nostrils blocked got really, 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 really narrow palates. All right, so if you go ahead and you think that you're brought up to where you can breathe through your nose and you have the correct nutrition to develop, but in breathing through your nose, correct nutrition, then you should have a nice broad palate, which means in theory you're going to have all 32 teeth. Doesn't happen much anymore for anybody. So it's a constant thing. Oh, I hit 16, 17, because you got the first molars appear at age 6, the second molars at age 12, the third molars, the wisdom teeth at age 18. How many times? It's constant. The oral surgeons, their busiest times are during the holidays, because that's when the kids are off school and they have all the kids that have to have their wisdom teeth taken out to have braces put in. All right?
And recovered.
Right. Okay. So you have that. All right. So Dr. Singh also says, the creator of the DNA appliance, that the first molars define the occlusion, the second molars define the airway, and the third molars, or the wisdom teeth, protect the brains from concussion. All right? So think of it that we're supposed to have all 32 teeth, but there's no room. So the big question is why?
Right.
That's the bridge over. So maybe you had no choice. Maybe you did, quote unquote, have to have your quote unquote wisdom teeth taken out because there was no room for it. Did it mean that it was the wrong thing? Not necessarily. Maybe you had to. Some kids have them coming in that way.
Yeah.
And then they end up with pockets and then infections and tumors. So yeah, sometimes you got to do what you got to do. And it's right for that person at that point in time. So please don't have regrets. You know?
Yes.
Don't have spilt milk. The question though is that, okay, you are where you are now, where do you go from here?
Awesome.
And that's the philosophy that I would have every single time. It's like, okay, what happened? Why did it happen? You're at the bottom of the rabbit hole. And this is how I explain it. Again, I do lots of analogies because visuals, I'm a very visual person. If you're bottom of the rabbit hole, which is dis-ease, and you know you want to be well, at what level of wellness are you happy that you want to get off the elevator, so to speak, back out of the rabbit hole? You could go ahead and stay there,
Right.
and you don't even know you're there. Or can you be aware that you're there, and you could be overwhelmed that you're there? So a lot of people get overwhelmed when they hear all the things that are not right, instead of saying wrong, all right, but things that aren't right with them, okay? And then they can have that journey. And it is a journey. Sometimes you could catch it as a baby and avoid them being down the rabbit hole, or some of them you can go ahead and depending on their age, child, teen, adult, 50s, 60s, 70s. I did arch expansion on an 83-year-old. 83, all right, with the ALF. And that's not even, it wasn't really my goal was arch expansion. It was just to relieve her TMJ issues.
Right, it gave her
all
quality
right?
of life.
Right.
Mm-hmm.
And now she has the most amazing broad smile. And I said, nobody's going to believe that this was done. You need to put a Google review. And she did. And she says, look, who would have thunk? And I said, yeah, 83.
Wow.
And they say the sutures are fuse at 9. They're fused when you're dead.
Yeah.
That's when they fuse. They never move after that.
I also find that it gives me hope that it's resolvable, that these things are relative,
Everything is.
and it's just a matter of time sometimes.
Einstein always said it, if you can't explain it easily, if you make it complicated, it's because you don't understand the subject.
Yeah.
And that's exactly where dentistry is. It boggles me to go ahead and, again, why? Why were you told this? Why are you thinking this? Why are you like this? It's like, well, I was told blah, 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 and you want to live with it?
Right.
No, you don't have to. So what do you want to do to change this?
Let's move into a little bit of Marcos' situation. It doesn't have to be.
I hope
there,
I'm not thinking, I don't want everybody to think I'm blackballing dentists, okay? Because I'm not.
No, but it's okay. You can. You
I'm
can
not,
a little
but
bit.
I don't want to blackball dentists because you got a lot of people who are doing the best that they can with what they know.
Absolutely.
And that's where I'm hoping, and I write this in the book. I say, I don't want my peers to think that this is a pedantic book, because it's not.
Right.
It's not against dentistry. It's just like, that there are, this is an outside the box thing. There's a lot of inside the box because you have no other, you have to drill and fill when you have decay. There's no choice. All right. But maybe there are other products you can use. Maybe there's a different way of restoring the bite that you can do. Maybe there are different ways of moving teeth. Maybe there are different ways to do everything that you weren't taught. And that's what I'm trying to get across.
Yeah, if you do everything the same exact way, you're never going to change. You're never going to see. And I mean, yeah, I agree with you. Dentistry as a whole will never shift to anything. Yeah. I'm actually helping you with
We're working on that. We're working on that. And I think what you're doing is amazing. And I think I applaud you for that. And I think you should continue full guns ahead, because it's moms like you that are going to change the world. It's a grassroots movement, and every single mom, you have power.
Let's continue to ruffle feathers.
Yeah, well, nice.
And give me, my listeners, your perspective on flora, because it's a hot topic.
Yeah. Well, so is mercury too, huh?
Yes. But I find, because my focus is a little more on younger kids, and then
they still put mercury in, and so the Mini Mata convention. They went ahead. There's a group. I contribute to it. There's a group against mercury. We don't want to warn mercury, but there's a group that's
smart.
There's that too. That's how you take it out. That's the IOMT protocol. There's what they did is they went ahead and they showed how detrimental mercury was, and they stopped practically using it in so many countries in the world, but they still use it here in this country. So unfortunately, they still use fluoride too. 98% of countries in the world don't use fluoride, but America does.
Yes.
And it's a forced drug on the population, because you don't have any say in it, which I think is wrong.
Yeah.
So you should have the choice to be able to take it. Now, again, the book, and this is something I said specifically, it's not meant to be a political statement. Do your own research, because the EPA doesn't allow it in the lakes. You can't throw away a thermometer in the lake. We now have, as dentists, supposed to use mercury. I'm digressing to mercury because it's important as a dentist. They're still out there. The ADA, American Dental Association, makes it to where now we have filters because they're still putting it in. And we dentists who follow, like you said, the SMART protocols, we take it out safely. All right, so it's an in and out process, but we actually take it out in such a fashion that it doesn't go back into the environment. So we have filters. I've been using a filter to my practice over a decade before they even made it law, if not longer. I've been mercury free since 1993, or I can't even remember. The years of don't flow anymore. I've been so long. I stopped using it. So it's like, why would I put in my kids? No. Would I put in my own mouth? No. And that is, I think, is the biggest rule of thumb, is would I do it to myself? Would I do it to my family? No.
Right.
Fluoride, I used to push fluoride big time. Why? Because that's what I was taught. I remember when I was in France, you actually were given little tablets, forget in the water, because they didn't fluoridate the water, so they actually gave you fluoridated tablets to take. And I remember when I was in Grenada, I had a friend who was giving her son the little fluoridated tablets because it was a good thing. And I said, okay, that's pretty cool. Now, I was in Grenada from 82, I graduated in 82, so 84 to 87. I was in Grenada for 2.5 years-ish. So what happened, 86, 84, 86. And I was like, okay, so she was giving him these fluoride tablets, and then I came here, and I didn't have children until late in life. I was 39, nearly 40 when I had my first one. And by then I was already changed in my whole way of thinking, because that was like, okay, funnily enough, my brother-in-law at the time said, who dealt in water waste management, said that it was toxic. I said, no, it's not. It's very good for your teeth. It makes them strong. And I was so pro fluoride, and I gave it to all my patients, and he kept fighting with me. And then after, I was like, holy shite. When you realize actually that it's a waste product for the in pesticide industry, fluorosilicic acid, is like, all right, okay, I get that now. And so no, I would not recommend it.
And that just one
item. And then the next big journey was trying to find an alternative.
Right.
So that's where I again researched, and I found xylitol. So xylitol is like, wow, what a multifaceted thing. It actually helps close the tubules, or those little openings on the teeth that decay so easily. But it also is a natural sugar. So you go ahead and you have that to where, and it makes bones stronger. And if you're, so I'm giving you all these benefits of the thing. So as a mom, if you're nursing and you're actually chewing xylitol gum, the baby gets it through the breast milk, but also when you kiss them, it kills the staphylococcus, those bacteria that cause decay, so they don't get cavities as easily. There's so many benefits to xylitol. It's like, it's a wonder thing as opposed to fluoride. It's like,
right.
You just don't know any different.